Hey guys, today I wanted to do a video about why I chose the insurance that I chose. I have a lot of reasons that I chose Pacific Cross. Pacific Cross is a pretty decent company and there's many choices. I've looked over the other insurance plans. There's plans for, like, from Scotland for people that live outside the country or travel a lot. Some of these companies, they're very expensive. There's a lot of things that they don't cover, so you have to have a large emergency fund. Some of them I found a little bit pricey for me. I just didn't feel like they were giving me what I needed because, to be honest with you, I don't need $1 million worth of coverage in the Philippines, okay? And one of the things, like, I felt like was I was overpaying for services that I really didn't need at the time. Okay, I'm not saying that people out there don't need $1 million worth of coverage in the Philippines. I'm saying that I just don't think it's warranted here in the Philippines. Because what happens here is that you can over-insure, okay? And by that I mean, unless you're really sick, diabetic, got, you have all kinds of sicknesses and stuff like that, pre-existing conditions. Pre-existing conditions aren't going to be covered here, okay? So you have to make sure that you're covered for those somehow, either by self-insuring or, sorry for all the noise, guys, but this is the way it is today. I just chose a different spot today because it was noisy over the other spot, but this spot's just as noisy or noisier. But anyway, what I was trying to say is that you can basically over-insure over here, okay? Because medical costs are so cheap here. I would highly recommend if you can put $30,000-$40,000 in the bank in your like emergency fund or something like that, then you might be okay as far as outpatient and just cover your own outpatient costs. Unless you got a lot of medical some of you guys are going to come over here, and you're coming over here and you're bringing your pre-existing conditions over here, which means you're going to have to cover those, and you need to fit that into your budget for sure, because you're going to have to be covering a lot of things over here unless you have some sort of insurance. And some of you guys come over here with TRICARE or what have you, and many of you guys, each person is different, let's face it. But for me, I picked Pacific Cross because, number one, they had a dollar plan. If I chose to go into the dollar plan, it was like $2,000 and something per year or something like that, okay? Which for me was a bit costly. I just didn't think I warranted all that insurance. I felt like I could switch to it later on if I wanted to. Then they had a peso plan. Now, in the peso plan, they had like different choices of, do you want to take a private room, semi-private room, or do you want to be in basically like a area where there's a bunch of people, okay? I'm okay being with a bunch of people, but then you got to deal with people bringing in food and it's stinky and stuff like that. So as far as that goes, I wanted to get at least like a semi-private room. I'll share it with somebody else, which I'm okay with, and it's a little bit different. It's a little bit quieter, and you pay a little bit more, but you get a little less coverage. Okay, now your age certainly makes a difference here. As you age, when you hit a certain age, you're going to hit a roadblock, because what's going to happen is you're going to age out of a plan, and then you have to go into like their senior plan, which I forget what they call it, but it's in Pacific Cross. It's really decent that they have that, okay? And it is going to cost a little bit more, and it is, it's just the way it is. You're aging, so prepare for that stuff, guys. Add to your emergency funds when you have extra money. Keep on saving, guys, because I can't stress that enough, because medical costs are going to go up. Your insurance is going to go up. If you're not keeping up with the cost of living and stuff like that here, then you're going to lose out later on. 10 years, 15 years down the road, you might find yourself not able to insure yourself. Now, I was looking at other plans the other day while I was, researching all this stuff for you guys, and some of the things that I found was that they have these other plans out there. They're for very, very, very poor people, and I don't find that they're really worth discussing. They have a lot of other insurance plans too, but they have like some sort of card out there, and I don't want to name the name of the card, just because. The card itself is something you pay like, you can pay like as low as 750 pesos a month, okay? And you get maybe $400 or $500 worth of the insurance or something like that, okay? And some of these cards cover pre-existing conditions, okay? But I'm not really, it doesn't give much information like how they work. I don't know if it's like a scam thing or whatever. I couldn't find much information on it. I'm gonna try to research that a little bit more. I really wanna dig into that more for you guys, because I'm trying to, I found a lot of information, and what I'm trying to do is I'm trying to disseminate all that information and figure out the best way to put it together for you guys. You know, that's why I wanted to kind of put this together today. Anyway, guys, what I want to say was that like Pacific Cross for me, though, to get back to this, Pacific Cross to me, because it's a little bit noisy and it's kind of like taken away from my flow here. Pacific Cross for me has been like a blessing, because it's really, really good. I mean, I'm lucky that I don't have to use it much. The other day they did pick up a little bit of my costs, you know, for something, and you know, and I was very thankful for that. Like I said, their plans, they have the dollar plan, the peso plan, and then they have the senior citizens plan. Okay, so, and their plan works outside of the country too in some cases if you get the right insurance. So just keep that in mind, guys. And also, they have a card. You can get a card and you pay a little bit more for it. You can ask them if you go through Pacific Cross. And then the card is that when you walk into a hospital that takes that card, and many hospitals here do, okay? You hand them the card. Just go to the hospitals that take that card. You hand them that card and boom, your bill is totally paid for, okay? So that's a good thing, all right? And, well, it's like really busy here. I thought it was gonna be nice and quiet here today, but it's like totally different than what I expected. Anyway, guys, that's a little bit why I chose my plan, okay? Because I like having the flexibility of switching between plans. Because if I find like when I hit 60 that I need to switch from the peso plan to the dollar plan, I can switch from the peso plan from the dollar plan. Now, these plans, like I said, they work kind of funny. So the first year, they're trying to weed out if you have any pre-existing conditions. So you're not really going to get much coverage during that year, okay? What's going to happen is they're trying to see if you have this or that or anything else, you know, and you're going to get all kinds of sicknesses and stuff like that, and they're trying to weed all that stuff out, okay? So anyway, what's going to happen is that you're going to have like almost zero coverage. So when you go to switch from one coverage, one coverage to another, like you're going from one plan to another, you might have to cover both plans, because you're still getting covered by one plan, so you want to get covered by the next plan. I got a guy selling ice cream over here now. But this is the Philippines, guys. This is the real stuff, you know? So you're getting to see it like raw material here. And I rather kind of do it this way anyway, because I don't want you guys to come over here and think that it's all bread and roses over here, and it's because it's not, you know? I love it over here, and I just kind of like go with the flow, and it's actually kind of fun going with the flow sometimes. And sometimes when you're trying to do something you really want some peace and quiet, it is what it is, guys, you know. And at home I got the same thing going on right now. It's Sunday and everybody's, you know, home, and they're playing music there, and you know, they're eating out in the cabana, and they're talking, they're playing basketball, and it's just and everybody's home, so it's very noisy there today. And it's usually only on Saturdays and Sundays, mostly on Sundays, that it's noisy. During the week it gets pretty quiet. But anyway, guys, I wanted to talk about that. Also, I want to talk while I'm on here. Let me talk about this. This week I will be doing this week and the week after. I'll be doing probably that insurance stuff this week, providing my health stays up this week, and I hope it does, because my health has been like up and down, like because of the kidney stones. But I mean, I'm hoping that everything goes fine, and we can do a video. I did a video the other day of a restaurant, and I got to go back and redo it because there was music in the video, and you can't have that because of copyright rules. And all that stuff because of music in the background. But you know, I was kind of hoping that I wouldn't have to, you know, redo that video. And then I had another place I was going to do this morning, but the weather has just not been, the weather, the noise, the quarantine, and just my health has been keeping me from getting some of the videos out that I want to get out. Okay, here. I mean, I can get them out. It's just that they're not going to be as good as I like. And I don't want to put out a video that's just garbage, you know. But anyway, guys, God bless. Take care, and I'm gonna have those videos out this week and next week, okay, on the insurance. I'm probably gonna be doing those from inside my house, which I know a lot of you guys don't like, but I mean, I know you guys rather have me do it outside. Having to do like an outside video lately has been really kind of rough, trying to do an outside video, unless I'm just walking around doing something and we're not discussing anything. But to really discuss something that's important, like what I'm trying to do now, it just doesn't work good, as you can see. Okay, it's just really noisy here on this corner. Okay, this isn't where I live. I live a little bits away from here, but this is like the garden for the elderly here. And I just thought I'd come over here, just try something different, but it's obviously not working here. So anyway, guys, God bless. Take care. I hope that helps a little bit about Pacific Cross, why I got it. It should help you a little bit. I do have older videos, guys, also on Pacific Cross, and I wish people would watch those videos, because I get so many people asking me questions, and I always revert them back to those videos. Okay, so keep that in mind, guys. Thanks, guys. God bless.